Hello guys, I hope you're fine. This is MEDLISS Healthcare, and I hope you went to the previous videos. You dropped a like, you gave me the comment, you told me how you feel about my content and what you think might be used to improve the channel. And I've gotten a lot of feedback from my friends, from everyone who goes to the YouTube channel. And today I have a very interesting topic. I want to talk about sexually transmitted infections, and this is a topic that everyone must follow. This is a topic that is very essential. This is a topic that affects a lot of people, and most of the people get misdiagnosed when they go to the hospital and get treated like urinary tract infection, and most probably is a sexually transmitted infection. So everything you learn from this group, it will help you in disease prevention and control, so that we can enlighten the society, so that we will be able to know how we can control these diseases, because we have a wide variety of bacteria and wide variety of infections. There is viral infection, there's bacterial infection, there's parasitic infections, and they can all affect you sexually. It can lead to more complications like infertility, like HIV. You can develop to AIDS and a lot of conditions. So I hope guys will enjoy, follow to the last minute, and make sure you leave a like, make sure you subscribe, make sure you give me a comment. Sexually transmitted infections or sexually transmitted diseases, and these are infections that are spread primarily through person to person sexual contact, either vaginal, anal, or oral sex. And there are more than 30 different sexual transmissible bacteria, viruses, and parasites. Several, in particular HIV and syphilis, can also be transmitted from mother to child during pregnancy and childbirth, and through blood products and tissue transfer. Sexually transmitted infections are caused by bacteria, viruses, and parasites. And we have common bacterial infections like Neisseria gonorrhoeae. It causes gonorrhea and gonococcal infections. We have Chlamydia trachomatis. It causes chlamydia infections. We have Treponema pallidum. It causes syphilis. We have Haemophilus ducreyi. It causes chancroid. We have Klebsiella granulomatis, which was previously known as Calimotobacterium granulomatis. It causes granuloma inguinae and donovanosis. We have also viral causes of sexually transmitted infections, and we have human immunodeficiency virus or HIV. It causes AIDS. We have herpes simplex virus type 2, causes genital herpes. We have human papilloma virus, which causes genital warts, and certain subtypes lead to cervical cancer. So HPV type 6 and 11 is responsible for about 90% of genital warts, and in men it affects the penis, the groin, the scrotum, thigh, and anus. In women, it affects the vulva, the vagina, the cervix, the anus, and the surrounding skin. And it can also appear in the mouth or throat if it's spread through oral sex. But cervical cancer is caused by type number 16 and 18, which is responsible for about 70% of cervical cancer cases. But there are also other high risk types like 31, 33, 45, 52, and 58. We have hepatitis B virus, which causes hepatitis, and chronic cases can lead to cancer of the liver. We have cytomegalovirus. It causes inflammation in a number of organs, including brain, eye, and the bowel. We have parasitic causes of sexually transmitted infections, and we have Trichomonas vaginalis, which causes vaginal trichomoniasis. We have Candida albicans, which causes vulvovaginitis in women, but when it affects men, it causes inflammation of the glans penis and foreskin, and it is called postditis. Sexually transmitted infections without symptoms. Some sexually transmitted infections exist without symptoms. For example, up to 70% of women and a significant proportion of men with gonococcal and chlamydia infections experience no symptoms at all. Both symptomatic and asymptomatic infections can lead to development of serious complications, sexually transmitted infections, and adverse outcome of pregnancy. Untreated sexually transmitted infections are associated with congenital and perinatal infections in neonates, particularly in regions where rates of infection remain high. In pregnant women with untreated early syphilis, 25% of pregnancies result in stillbirth and 14% in neonatal death, an overall perinatal mortality of about 40%. Up to 35% of pregnancies among women with untreated gonococcal infections result in spontaneous abortion and premature deliveries, and up to 10% in perinatal deaths. In the absence of prophylaxis, 30 to 50% of infants born to mothers with untreated gonorrhea and up to 30% of infants born to mothers with untreated chlamydia infections will develop serious eye infection called ophthalmia neonatorum, which is a severe conjunctivitis in newborn, usually occurring within the first 28 days of life, and it is often due to bacterial infections acquired during birth, and it is a medical emergency because it can lead to blindness if untreated. Common symptoms in this condition is redness and swelling of the eyelids, purulent or watery discharge, severe eyelid edema, especially in gonococcal infections, corneal ulceration if severe, especially with gonococcal infections. Worldwide, 1,000 to 4,000 newborn babies become blind every year because of this condition. Sexually transmitted infections and HIV. The presence of untreated sexually transmitted infections, both those which cause ulcers and those which do not, increase the risk of both acquisitions and transmission of HIV by a factor of up to 10. Prompt treatment for sexually transmitted infections is thus important to reduce the risk of HIV infection. Controlling sexually transmitted infections is important for preventing HIV infection, particularly in people with high-risk sexual behaviors. Common signs and symptoms of sexually transmitted infections are urethral discharge, genital ulcers, inguinal swelling, bubo, which is swelling in the groin, scrotal swelling, vaginal discharge, low abdominal pain, neonatal eye infections, that is conjunctivitis of the newborn, and also we have complications if untreated. You can get infertility because of untreated chlamydia or gonorrhea infections. You can get pelvic inflammatory disease, PID, in women. You can get ectopic pregnancy, increased risk of HIV transmission, and also you can get neurological and cardiovascular complications, for example, in syphilis. Prevention of sexually transmitted infections. The most effective means to avoid becoming infected with or transmitted sexually transmitted infections is to abstain from sexual intercourse, either oral, vaginal, or anal sex, or to have a sexual intercourse only within a long-term, mutually monogamous relationship with an infected partner. Male latex condoms, when used consistently and correctly, are highly effective in reducing the transmission of HIV and AIDS and other sexually transmitted infections, including gonorrhea, chlamydia infections, and trichomoniasis. Genital warts, HPV. We said that they are caused by HPV type 6 and 11. You don't have to have sex to get an STD. Skin-to-skin contact is enough to spread HPV, the virus family that causes genital warts. Some types cause warts and are usually harmless, but others may lead to cervical or anal cancer. Vaccines can protect against some of the most dangerous types. Signs: pink or flesh-colored warts that are usually flat or shaped like a cauliflower. Often there are no symptoms. Crabs or pubic lice. Crabs is the common term for lice that set up shop in the pubic hair. The term comes from the shape of the tiny parasites, which look different from head or body lice. The creatures crawl from one person to another during close contact. Pubic lice can be killed with over-the-counter lice-killing lotions. The symptoms you have is intense itching, tiny eggs attached to the pubic hair, or crawling lice. Scabies. Scabies is an itchy infestation caused by a tiny mite that burrow into human skin to lay eggs. It is not always an STD, as it can spread through skin-to-skin contact, but among young adults, the mites are often acquired during sex. Scabies are treated with prescription mite-killing creams. Symptoms you might have is intense itching, especially at night, and a pimple-like rash. It may take 2 to 6 weeks for symptoms to appear. The clap or gonorrhea. Gonorrhea can spread easily and can lead to infertility in both men and women if untreated. Antibiotics stop the infection. Symptoms. Common symptoms are burning during urination and discharge, but often there are no early symptoms. Later, the infections may cause skin rashes and spread to joint and blood. In men, discharge from penis and swollen testicles. In women, vaginal discharge, pelvic pain, spotting. Symptoms may be mild and are easily confused with urinary tract infections and vaginal infections. Syphilis. Most people don't notice early symptoms of syphilis. Without treatment, it can lead to paralysis, blindness, and death. Syphilis can be cured with antibiotics. Signs and symptoms. The first sign is usually a firm, round, painless sore on the genitals or anus. The disease spread through direct contact with this sole. Later, there may be a rash on the soles, palms, or other parts of the body, as well as swollen glands, fever, hair loss, or fatigue. In the late stage, symptoms come with damage of organs such as heart, brain, liver, and nerves. Trichomoniasis. Trichomoniasis is caused by a parasite that spread during sexual contact. It can be cured with prescription drugs. Signs and symptoms in men. Most men have no obvious symptoms. Some develop a mild discharge or slight burning during urination. Signs and symptoms in women. Women may develop a yellow to green discharge with a strong odor, vaginal itching, or pain during sex or urination. Symptoms usually begin 5 to 28 days after acquiring the parasite. Chancroid. Chancroid is a bacterial sexually transmitted disease that is common in Africa and Asia, but rare in the US. It causes genital soles that can spread the bacteria from one person to another, and antibiotics can cure the infections. Symptoms in men. Painful bumps on the penis that may develop into pus-filled open sore, and pain in the genitals and groin. Symptoms in women. Painful bumps in the genital area that can develop into open sores and swollen lymph nodes in the groin. LGV, lymphogranuloma venereum. LGV is caused by a type of chlamydia that is usually rare in the US, but it is becoming more common in men who have sex with men. Like other forms of chlamydia, it can be cured with antibiotics. Symptoms: open sores in the genitals or anus, headache, fever, fatigue, and swollen lymph glands in the groin. If acquired through anal sex, LGV may cause rectal bleeding or discharge. Pelvic inflammatory disease. It is not a sexually transmitted disease itself, but pelvic inflammatory disease is a serious complication of untreated sexually transmitted disease, especially chlamydia and gonorrhea. It happens when the bacteria spread to infect the uterus and other female reproductive organs. Prompt treatment is essential to prevent damage to woman's fertility. Signs and symptoms: low abdominal pain, fever, unusual discharge, painful intercourse, painful urination, and spotting. There are often no warning signs. Let us ask ourselves, who is at risk for sexually transmitted diseases? Anyone who is sexually active is at risk for sexually transmitted diseases, regardless of your gender, race, social class, or sexual orientation. That said, teenagers and young adults acquire STDs more easily than older people. By age 25, half of sexually active adults get a sexually transmitted disease. Having multiple sexual partners also raises your risk. The Center of Disease Control has noted that some sexual transmitted diseases are on the rise in men who have sex with men, including syphilis and lymphogranuloma venereum. Can virgins get sexually transmitted diseases? Yes, they can. Many sexually transmitted diseases spread through any type of sexual activity, including skin to skin contact and oral sex. This is especially true of sexually transmitted diseases that produce genital lesions or sores. Preventing sexually transmitted diseases. The best way to avoid getting an STD are to abstain from sexual contact and be in a monogamous long-term relationship with an infected partner to reduce your odds of getting STDs. Ask your partner if he or she has an STD. Ask your partner to be tested before sexual activity. Use condoms. Avoid sexual activity if your partner has signs of sexually transmitted diseases. Be aware of symptoms and get regular checkups with your healthcare provider. The limits of condoms. While condoms are effective in preventing the spread of sexually transmitted diseases, they are not perfect. Condoms are better in protecting against gonorrhea, chlamydia, HIV, and trichomoniasis, but they offer less protection against herpes, syphilis, and genital warts. These infections are spread or can be spread through contact with skin lesions that are not covered by a condom. Finally, condoms offer virtually no protection against crabs and scabies. How to tell your partner? If you think you have a sexually transmitted disease, tell your partner or partners as soon as possible. You may be able to spread the infection even if you have already begun treatment or are using condoms. With some sexually transmitted diseases, doctors recommend treating both partners at the same time. This may be a difficult conversation. Some people find it helpful to write a script ahead of time. Be sure to let your partner ask questions and express his or her feelings. Sexually transmitted diseases and pregnancy. It is important for pregnant women to be checked for sexually transmitted diseases. They can cause women to go into labor too early and may complicate delivery. Many sexually transmitted diseases can be passed from mother to baby during pregnancy, childbirth, or after the baby is born. Sexually transmitted diseases effects on babies can include stillbirth, low birth weight, neurologic problems, blindness, liver disease, and serious infections. But there are treatments to minimize these risks. Treatment during pregnancy can cure some sexually transmitted diseases and lower the risk of passing the infection to your baby. The final question we are going to ask ourselves: can a sexually transmitted disease come back? Most sexually transmitted diseases treatments do not protect you from getting the same infection again. A course of drug may cure gonorrhea, syphilis, chlamydia, or trichomoniasis, but a new exposure can start a new infection. If your partner is not treated, you can continue to pass infection back and forth. And if you're not taking the right precautions to protect yourself, you can be reinfected quickly or even pick up a second sexually transmitted disease. Thank you for your time. Thank you for your patience. And I hope the information has been so helpful to you. So don't forget to like, Don't forget to subscribe, forward to your friends, forward to your family members, and let us continue learning. Go to the previous videos. Be sure to ask questions on the comment section. Make sure you tell me the topic you want me to discuss next. I can see the channel is growing because of your support. I'm so grateful, and I'm so humbled. I don't take your support for granted. And let us continue supporting, let us continue enlightening the society. And that is all for today. And let us meet next time. Ciao, guys.